on clean gloves. So it just depends on where the gloves are in the room. Some of the rooms are going to be over here on this wall. Others are going to be in drawers. We'll tell you where they're all going to be when you get here. You want to make sure that your jacket is zipped up and your scrubs are protected. The first thing that we're going to do, since we have clean gloves, is we're going to take this blanket from the patient. You're going to leave one hand clean, one hand dirty, and you're going to take this to the laundry, which is in the shred. So you'll open the door with your clean hand, put this in the basket, and then close the door with your clean hand. Then you're going to come back into the room with your dirty gloves, and you're just going to start tearing everything down that's dirty. So you're going to get rid of all the paper products. This tray has a lot because it's a crown prep. You're going to get rid of all this stuff. And then you're going to take off these instruments. And these just pull straight off. They're a little hard, so you just got to pull. And you just put those there. This impression. And you're going to come back over to the round. You've also got more paper products, so you're just going to kind of crumple all of this stuff up into a nice little ball. And you're going to take this off. And you're going to want to make this as small as possible, so we just wrap it around. And then you're going to shove it in this little garbage hole. And now you can start putting your instruments in your tray. Being careful that you're not touching any of the working ends because they're sharp. There's a couple instruments over here on this side. So we'll grab those. And you're going to grab your burrs. Again, making sure you're not touching any of the working sides because they're sharp. All of your burrs and hand pieces can go in this tray. All of this goes inside your cassette. And snapped in. And then once you have everything in place, you're going to take this and you're going to put these right in these little grooves, just like this. And you're going to hold it down and fold it over. And you're going to hold this down and turn these horizontal. That locks the tray. Next, you're going to grab this cover. It's a locking tray cover. And you're going to cover these loose instruments and take your cassette and stick it right on top. Okay. I got one more piece of paper that I forgot. Okay, so now that you've gotten all of your dirty stuff out of the way, you are going to take off your gloves. I have a temporary impression, so I'm going to take off one glove right now, since this baggie is clean. And I'm going to take this temporary impression and just slide it in without touching my clean hand. And put it back on this clean counter. And then take off your other glove, always sticking your thumb underneath and pulling up so that you're not touching the dirty exposed glove. You're going to get a new pair of gloves. And now you're going to get your wipe. You're going to open this, pull out one wipe, and then you're going to close it. It's really important that these get closed because they dry out really fast. So this wipe is pretty saturated. However, the kill time for these chemicals is 3 minutes. So that means that the object you're cleaning has to be saturated for 3 minutes. So I always take my spray and I spray down my wipe and make it extra dark or extra wet. And then you just kind of slowly start to clean. So we're going to clean everything that we could possibly have touched. And you're going to make sure that it's fully saturated. And notice I have my white hand and then I still have my clean gloved hand that I'm going to use to hold everything after I've cleaned it. You always want to just make sure your wipe is open so you can kind of grab things. And kind of clean everywhere because like that video shows, that saliva goes everywhere. You're also gonna grab these and start cleaning these. And again, you wanna make sure that you're pushing these up and back down to clean them because they get used during the procedures. So they're covered in pathogens. Same thing over here. I'm always only touching the clean area with this clean hand. And same with all of your products. And I always make myself a clean countertop. Even though this is my clean space, I still make sure it's extra clean to set my clean things on. You never want to set it back on a dirty spot because it'll be dirty. And get up inside these little wells and put them in there. And now I can kind of tell that my glove or my towel is starting to get a little bit more dry. It's not quite as saturated. So I'm going to saturate it again to make sure that what I'm cleaning is going to stay saturated for 3 minutes. Otherwise it won't be sterile. These little guys are a little harder, so I just kind of get them nice and wet and really kind of get up in there because they've got all these little pieces. Clean it around. And then you always want to kind of make a lip with your wipe and go all the way around because usually the dentist or the assistant has grabbed the table at some point, so it's going to be dirty underneath. Move on over here. And you're just going to put everything on that clean side. So that way, if someone comes in after you, they know everything over there is clean. And we're going to wait to wipe the back counter until we go to take our stuff into sterile since our other dirty instruments are over there. And my wipe again is getting less wet, so I'm going to saturate it some more. And then I'm going to clean the assistant chair over here. And you want to make sure you also get underneath it, around the edges. And then there's a little handle over here. So you want to make sure you get that too, in case the girls had to use it at all during the treatment. Now you're going to clean the light handles and this little switch in the back. Okay. And again, you can tell it's getting less wet, so we're going to saturate it again. Sometimes you'll see these shields and you're just going to clean both sides of them as well. Always making yourself a place to touch. That's clean. And you'll just set it over here. I'm going to get these handles, both sides. And then we're going to wait to do the foot area until we're all done using this wipe. Because it can get pretty dirty. So before I go over to this side to clean the doctor's side, I'm going to saturate my wipe again. Okay, we're going to clean this area over here where doctor gets spurs and all that out of. Anything that could have possibly been touched, you want to make sure it's clean. Now with this tray, you kind of want to do the same. We're going to clean this top edge that you can see, but you also want to clean around the lip as well as underneath. Because if the doctor's working and he has any saliva or blood on his hands and he grabs the tray, it's going to be underneath it. And then you're going to clean these handles all the way up. There's a little button, you'll feel it. I'm going to clean all of this, both sides. Now with these, you're going to grab the ends Give them a good scrub. And then you're gonna go all the way up the tube and up this piece as well. And then you're gonna get all behind it and make sure that's clean. And then I always set mine off to the side so I know that I've cleaned that one. You're gonna move on to the next one. And the next one. Clean this whole area here. And then you're also gonna clean this little camera cord. Usually the easiest way to do that is to go up instead of grabbing it from the bottom, because you don't really wanna get anything inside this little piece, because that's where all the housing is. So you just kind of want to stay on the outside of it. Again, cleaning underneath it. And then you're also going to want to clean any of these little grooves here, because they like to catch stuff, as well as this back area here. And these, because sometimes the girls have to grab these as well. Okay, and now your room essentially is clean, so you're going to wipe this foot pedal. And then you're going to come back here. And I'm going to spray one more time, because I've got to clean this back counter still. And then you're going to pick this up safely, and you're going to hold it like this. Wipe one more time over here. You're going to wipe these lights, and you're going to wipe down this nitrous. And then you're going to wipe this area right here, as well as this little cubby and this cubby. We get into these all the time. You're going to wipe down this clock and any of these doors. You never know if they need to get in them. And you're going to carry all this out of the room into sterile. And that's how you clean the room.